Hello, future healthcare professionals. Welcome to Nursing Exam Preparation, your trusted partner in mastering the essential knowledge and skills needed for exceptional patient care. In today's video, we'll guide you through 250 true/false questions focused on pathophysiology, a fundamental topic that forms the backbone of understanding diseases and their impact on the human body. Each question is carefully crafted to assess your knowledge of key pathophysiological concepts, enhance your clinical reasoning, and deepen your understanding of disease processes. After every question, we'll provide detailed rationales to help you grasp not only the correct answer, but also the critical reasoning behind it, empowering you to apply this knowledge in real-world scenarios. Whether you're just starting your journey into pathophysiology or preparing for critical exams, this video is packed with valuable insights to strengthen your foundation, build your confidence, and guide you toward success. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more expert-curated resources tailored to your learning needs. Hit the bell icon to stay updated with our latest videos. We're here to support your journey with engaging and practical content. Once you've completed the quiz, share your score in the comments below. We're excited to celebrate your progress. Let's dive into these questions and take an important step toward becoming a confident and knowledgeable healthcare professional. Ready? Let's get started. 1. Inflammation is a nonspecific immune response triggered by tissue injury or infection. True or false? Answer: true. Rationale: inflammation is a fundamental, nonspecific response to tissue damage caused by infection, trauma, or irritants. It aims to isolate the threat, initiate repair, and restore homeostasis. 2. Chronic obstructive pulmonary disease, COPD, is characterized by reversible airflow limitation. True or false? Answer: false. Rationale: COPD involves irreversible airflow limitation due to chronic bronchitis or emphysema, typically caused by long-term exposure to irritants like tobacco smoke. 3. Diabetes mellitus type 1 results from autoimmune destruction of insulin-producing beta cells. True or false? Answer: true. Rationale: type 1 diabetes is an autoimmune condition in which the immune system attacks beta cells in the pancreas, leading to absolute insulin deficiency. 4. Iron deficiency anemia often manifests with symptoms of fatigue, pallor, and tachycardia. True or false? Answer: true. Rationale: iron deficiency anemia reduces oxygen delivery to tissues, causing fatigue and pallor. Tachycardia occurs as a compensatory mechanism to maintain oxygen supply. 5. A stroke affecting the left cerebral hemisphere typically causes right-sided motor deficits. True or false? Answer: true. Rationale: the motor pathways cross at the medulla, so a left hemisphere stroke affects the motor function of the contralateral, right, side of the body. 6. Hypertension is often referred to as the silent killer because it typically has no symptoms. True or false? Answer: true. Rationale: hypertension is asymptomatic in many cases, which makes early detection challenging. Left untreated, it increases the risk of heart disease, stroke, and kidney damage. 7. Rheumatoid arthritis is caused by uric acid crystal deposition in the joints. True or false? Answer: false. Rationale: rheumatoid arthritis is an autoimmune disease causing systemic inflammation, while gout involves uric acid crystal deposition in joints. 8. Asthma is characterized by chronic inflammation and hyperresponsiveness of the airways. True or false? Answer: true. Rationale: asthma involves airway inflammation, bronchial hyperresponsiveness, and reversible obstruction, often triggered by allergens or irritants. 9. Atherosclerosis is a condition where arteries lose elasticity and develop plaques. True or false? Answer: true. Rationale: atherosclerosis involves the deposition of lipids, calcium, and inflammatory cells in arterial walls, leading to reduced elasticity and lumen narrowing. 10. Cushing syndrome is caused by hypersecretion of insulin from the pancreas. True or false? Answer: false. Rationale: Cushing syndrome results from excessive cortisol, often due to an adrenal tumor or long-term corticosteroid use, not insulin hypersecretion. 11. Hypothyroidism commonly presents with symptoms of weight gain, fatigue, and cold intolerance. True or false? Answer: true. Rationale: in hypothyroidism, reduced thyroid hormone levels slow metabolism, leading to symptoms like weight gain, fatigue, and cold sensitivity. 12. Myocardial infarction occurs when there is prolonged ischemia and death of myocardial tissue. True or false? Answer: true. Rationale: myocardial infarction, heart attack, results from prolonged oxygen deprivation due to a blockage in coronary circulation, causing tissue necrosis. 13. Septic shock is a form of distributive shock caused by systemic infection and inflammation. True or false? Answer: true. Rationale: septic shock occurs due to overwhelming infection leading to systemic inflammation, vasodilation, and impaired tissue perfusion, causing hypotension and organ dysfunction. 14. Alzheimer's disease is characterized by the accumulation of amyloid plaques and tau tangles in the brain. True or false? Answer: true. Rationale: Alzheimer's disease involves amyloid beta plaques and neurofibrillary tangles, disrupting neuronal function and communication, leading to progressive cognitive decline. 15. Acute pancreatitis is often caused by gallstones or chronic alcohol use. True or false? Answer: true. Rationale: gallstones and alcohol abuse are the most common causes of acute pancreatitis, leading to inflammation of the pancreas due to enzymatic activation. 16. Chronic kidney disease, CKD, is defined by a decreased glomerular filtration rate, GFR, or kidney damage for over 3 months. True or false? Answer: true. Rationale: CKD is diagnosed when GFR remains less than 60 ml/min/1.73 m superscript 2 or evidence of kidney damage, e.g., proteinuria, persists for more than 3 months. 17. Peripheral artery disease, PAD, typically presents with intermittent claudication and cold extremities. True or false? Answer: true. Rationale: PAD involves reduced blood flow to the limbs due to atherosclerosis, causing muscle pain during exertion, claudication, and cool skin due to poor perfusion. 18. Hyperkalemia is associated with flattened T waves on an ECG. True or false? Answer: false. Rationale: hyperkalemia typically causes tall, peaked T waves, not flattened ones, due to increased extracellular potassium affecting cardiac repolarization. 19. Hypoglycemia is commonly treated with oral or 4-glucose administration. True or false? Answer: true. Rationale: immediate glucose replacement is the primary treatment for hypoglycemia to restore blood sugar levels and prevent complications like altered consciousness or seizures. 20. Osteoporosis is characterized by increased bone density and strength. True or false? Answer: false. Rationale: osteoporosis involves decreased bone mass and density, increasing fracture risk due to weakened bone structure. 21. Parkinson's disease is caused by the loss of dopamine-producing neurons in the substantia nigra. True or false? Answer: true. Rationale: Parkinson's disease involves the progressive loss of dopaminergic neurons in the brain, leading to motor symptoms like tremors, rigidity, and bradykinesia. 22. Peptic ulcer disease is primarily caused by Helicobacter pylori infection and NSAID use. True or false? Answer: true. Rationale: H. pylori infection and NSAID use are the 2 major causes of peptic ulcers, which damage the gastric or duodenal lining. 23. Anemia of chronic disease is often associated with increased serum ferritin levels. True or false? Answer: true. Rationale: anemia of chronic disease involves iron sequestration in macrophages, leading to increased ferritin levels despite limited iron availability for erythropoiesis. 24. Acute respiratory distress syndrome, ARDS, is characterized by fluid-filled alveoli and refractory hypoxemia. True or false? Answer: true. Rationale: ARDS causes alveolar damage and fluid accumulation, impairing gas exchange and resulting in hypoxemia that does not improve with supplemental oxygen. 25. Hepatitis B is primarily transmitted through the respiratory route. True or false? Answer: false. Rationale: hepatitis B is transmitted through blood, sexual contact, or perinatal routes, not through respiratory pathways. 26. Hyperthyroidism may present with tachycardia, weight loss, and heat intolerance. True or false? Answer: true. Rationale: increased thyroid hormone levels in hyperthyroidism accelerate metabolism, causing symptoms like tachycardia, weight loss, and heat intolerance. 27. Sickle cell anemia is caused by a mutation in the hemoglobin gene, leading to abnormal red blood cell shape. True or false? Answer: true. Rationale: a genetic mutation in hemoglobin S causes red blood cells to become sickle-shaped under stress, leading to vaso-occlusive crises and anemia. 28. Hypovolemic shock is characterized by decreased cardiac output due to systemic vasodilation. True or false? Answer: false. Rationale: hypovolemic shock results from reduced blood volume, e.g., due to hemorrhage, not systemic vasodilation, which is a feature of distributive shock. 29. Aortic stenosis may lead to left ventricular hypertrophy due to increased afterload. True or false? Answer: true. Rationale: aortic stenosis causes resistance to blood ejection from the left ventricle, leading to hypertrophy as a compensatory response to increased afterload. 30. Diabetic ketoacidosis, DKA, is associated with high blood glucose levels, ketonemia, and metabolic acidosis. True or false? Answer: true. Rationale: DKA is a life-threatening complication of diabetes characterized by hyperglycemia, ketone production, and an anion gap metabolic acidosis due to insulin deficiency. 31. Chronic bronchitis is classified as a restrictive lung disease. True or false? Answer: false. Rationale: chronic bronchitis is an obstructive lung disease characterized by airway inflammation and mucus hypersecretion, leading to airflow obstruction. 32. Hypercalcemia is a common finding in patients with hyperparathyroidism. True or false? Answer: true. Rationale: hyperparathyroidism leads to increased parathyroid hormone, PTH, levels, causing excessive calcium release from bones, absorption from the gut, and reabsorption from the kidneys. 33. Multiple sclerosis, MS, involves the degeneration of peripheral nerves. True or false? Answer: false. Rationale: MS is an autoimmune disease that affects the central nervous system, causing demyelination of neurons in the brain and spinal cord, not the peripheral nerves. 34. Deep vein thrombosis, DVT, is a risk factor for pulmonary embolism. True or false? Answer: true. Rationale: DVT can lead to pulmonary embolism if a clot dislodges and travels to the pulmonary arteries, obstructing blood flow. 35. Left-sided heart failure typically causes peripheral edema and ascites. True or false? Answer: false. Rationale: left-sided heart failure leads to pulmonary congestion, e.g., dyspnea or orthopnea, while right-sided failure causes peripheral edema and ascites due to systemic venous congestion. 36. Varicose veins are caused by incompetent venous valves, leading to blood pooling. True or false? Answer: true. Rationale: varicose veins occur when venous valves fail, allowing blood to flow backward and pool, causing venous dilation and tortuosity. 37. Hypernatremia occurs when serum sodium levels are below 135 milliequivalent/L. True or false? Answer: false. Rationale: hypernatremia is defined by serum sodium levels above 145 milliequivalent/L, while levels below 135 milliequivalent/L indicate hyponatremia. 38. Addison's disease is caused by adrenal gland hypofunction leading to cortisol deficiency. True or false? Answer: true. Rationale: Addison's disease involves adrenal insufficiency, resulting in inadequate cortisol and sometimes aldosterone production, causing symptoms like fatigue, weight loss, and hypotension. 39. Atrial fibrillation increases the risk of stroke due to thrombus formation in the atria. True or false? Answer: true. Rationale: Atrial fibrillation causes blood stasis in the atria, increasing the risk of thrombus formation and subsequent embolic events like stroke. 40. Guillain-Barré syndrome is an autoimmune disorder affecting peripheral nerves. True or false? Answer: true. Rationale: Guillain-Barré syndrome involves immune-mediated demyelination or axonal damage in peripheral nerves, leading to ascending weakness and paralysis. 41. Psoriasis is an autoimmune disease characterized by rapid skin cell turnover and plaque formation. True or false? Answer: true. Rationale: psoriasis results from an immune response that accelerates skin cell proliferation, leading to plaques of thickened, scaly skin. 42. Tuberculosis is caused by the bacterium Mycobacterium leprae. True or false? Answer: false. Rationale: tuberculosis is caused by Mycobacterium tuberculosis, while Mycobacterium leprae causes leprosy. 43. Huntington's disease is an inherited disorder caused by an expansion of CAG repeats in the HTT gene. True or false? Answer: true. Rationale: Huntington's disease is a genetic disorder resulting from a trinucleotide repeat expansion in the Huntington HTT gene, causing progressive neurological degeneration. 44. Sarcoidosis is characterized by the formation of non-caseating granulomas in affected organs. True or false? Answer: true. Rationale: sarcoidosis involves immune-mediated granuloma formation in organs like the lungs, lymph nodes, and skin, without central necrosis, non-caseating. 45. Hyperlipidemia is a risk factor for atherosclerosis and cardiovascular disease. True or false? Answer: true. Rationale: elevated lipid levels contribute to plaque formation in blood vessels, increasing the risk of atherosclerosis and related cardiovascular events. 46. Hepatic encephalopathy is caused by elevated ammonia levels due to liver dysfunction. True or false? Answer: true. Rationale: liver dysfunction in hepatic encephalopathy impairs ammonia metabolism, leading to neurotoxic effects and altered mental status. 47. Celiac disease is an autoimmune disorder triggered by gluten ingestion in genetically predisposed individuals. True or false? Answer: true. Rationale: celiac disease involves an immune reaction to gluten in people with HLA-DQ2 or HLA-DQ8 genes, causing intestinal inflammation and malabsorption. 48. Bell's palsy affects both sides of the face simultaneously. True or false? Answer: false. Rationale: Bell's palsy typically causes unilateral facial paralysis due to inflammation of the facial nerve, cranial nerve 7. 49. Iron deficiency anemia commonly presents with microcytic, hypochromic red blood cells. True or false? Answer: true. Rationale: iron deficiency anemia is characterized by smaller, microcytic, pale, hypochromic red blood cells due to inadequate hemoglobin production. 50. Erythropoietin is produced primarily in the liver to stimulate red blood cell production. True or false? Answer: false. Rationale: erythropoietin is primarily produced by the kidneys, not the liver, in response to hypoxia, to stimulate red blood cell production in the bone marrow. 51. Hemophilia is caused by a deficiency in clotting factor 8 or 9. True or false? Answer: true. Rationale: hemophilia A is due to factor 8 deficiency, while hemophilia B involves factor 9 deficiency, both causing impaired blood clotting. 52. Hypermagnesemia is often associated with kidney failure. True or false? Answer: true. Rationale: impaired renal function can lead to reduced magnesium excretion, resulting in hypermagnesemia. 53. Ankylosing spondylitis is a chronic inflammatory disease primarily affecting the axial skeleton. True or false? Answer: true. Rationale: ankylosing spondylitis causes inflammation of the axial skeleton, particularly the sacroiliac joints and spine, leading to pain and stiffness. 54. Graves' disease is a form of hypothyroidism. True or false? Answer: false. Rationale: Graves' disease is a form of hyperthyroidism caused by autoimmune stimulation of the thyroid gland. 55. Crohn's disease can affect any part of the gastrointestinal tract, from mouth to anus. True or false? Answer: true. Rationale: Crohn's disease is an inflammatory bowel disease that can involve any part of the gastrointestinal tract, with skip lesions and transmural inflammation. 56. Phenylketonuria is caused by a deficiency in the enzyme phenylalanine hydroxylase. True or false? Answer: true. Rationale: Phenylketonuria is a metabolic disorder caused by a mutation leading to deficient phenylalanine hydroxylase activity, resulting in toxic accumulation of phenylalanine. 57. Systemic lupus erythematosus, SLE, is associated with the presence of anti-nuclear antibodies, ANA. True or false? Answer: true. Rationale: SLE is an autoimmune disease frequently associated with ANA positivity, reflecting an immune reaction against the body's own cells. 58. Hypocalcemia can lead to tetany and schwastexine. True or false? Answer: true. Rationale: low calcium levels increase neuromuscular excitability, leading to symptoms like tetany and positive schwastexine, facial muscle twitching. 59. Polycystic kidney disease, PKD, is an inherited disorder causing cyst formation in the kidneys. True or false? Answer: true. Rationale: PKD is a genetic condition characterized by the growth of fluid-filled cysts in the kidneys, potentially leading to renal failure. 60. Marfan syndrome is caused by a mutation in the fibrillin-1, FBN1 gene. True or false? Answer: true. Rationale: Marfan syndrome is an autosomal dominant disorder resulting from a mutation in the FBN1 gene, affecting connective tissue integrity and causing features like aortic aneurysms and skeletal abnormalities. 61. Scurvy is caused by a deficiency in vitamin B12. True or false? Answer: false. Rationale: scurvy is caused by vitamin C deficiency, not vitamin B12, leading to impaired collagen synthesis and symptoms like gum bleeding and poor wound healing. 62. Klinefelter syndrome is a genetic disorder characterized by the karyotype 47XXY. True or false? Answer: true. Rationale: Klinefelter syndrome is a chromosomal abnormality involving an extra X chromosome, 47XXY, resulting in hypogonadism and other physical and cognitive symptoms. 63. Wilson's disease is caused by excessive accumulation of iron in the body. True or false? Answer: false. Rationale: Wilson's disease is caused by defective copper metabolism due to a mutation in the ADP7B gene, leading to copper accumulation in tissues like the liver and brain. 64. Erythrocytosis refers to an increase in red blood cell mass. True or false? Answer: true. Rationale: erythrocytosis is characterized by an elevated red blood cell mass, which may occur due to primary or secondary causes, such as chronic hypoxia or polycythemia vera. 65. Turner syndrome affects males and is characterized by a 45XO karyotype. True or false? Answer: false. Rationale: Turner syndrome affects females and involves a missing or partially missing X chromosome, 45XO, causing short stature, gonadal dysgenesis, and other features. 66. The pituitary gland is located in the hypothalamus. True or false? Answer: false. Rationale: the pituitary gland is located below the hypothalamus in the sella turcica of the sphenoid bone, not within the hypothalamus. 67. Diabetes insipidus results from a deficiency in insulin production. True or false? Answer: false. Rationale: diabetes insipidus is caused by a deficiency of antidiuretic hormone, ADH, or renal insensitivity to it, not insulin deficiency, which causes diabetes mellitus. 68. Aortic stenosis often presents with a systolic murmur heard best at the second intercostal space. True or false? Answer: true. Rationale: aortic stenosis causes a systolic murmur that is typically heard best at the second intercostal space on the right side of the sternum. 69. Hashimoto's thyroiditis is the most common cause of hyperthyroidism in developed countries. True or false? Answer: false. Rationale: Hashimoto's thyroiditis is the most common cause of hypothyroidism, not hyperthyroidism, in developed countries. 70. Osteoporosis results in increased bone density and strength. True or false? Answer: false. Rationale: osteoporosis causes decreased bone density and strength, increasing the risk of fractures. 71. Vitamin D deficiency can lead to rickets in children. True or false? Answer: true. Rationale: vitamin D deficiency impairs calcium absorption, leading to rickets in children, characterized by bone deformities. 72. Hyperkalemia is characterized by low potassium levels in the blood. True or false? Answer: false. Rationale: hyperkalemia refers to elevated potassium levels in the blood, while low potassium levels indicate hypokalemia. 73. Rheumatic fever is a complication of streptococcal pharyngitis. True or false? Answer: true. Rationale: rheumatic fever is an inflammatory condition that can follow untreated or poorly treated group a streptococcal pharyngitis. 74. Mitral valve prolapse is commonly associated with Marfan syndrome. True or false? Answer: true. Rationale: mitral valve prolapse is frequently seen in patients with Marfan syndrome due to connective tissue abnormalities. 75. Multiple sclerosis is caused by the destruction of myelin in the central nervous system. True or false? Answer: true. Rationale: multiple sclerosis is an autoimmune disorder where the immune system attacks myelin in the CNS, leading to neurological dysfunction. 76. The spleen is a primary lymphoid organ. True or false? Answer: false. Rationale: the spleen is a secondary lymphoid organ, while primary lymphoid organs include the thymus and bone marrow. 77. Acute pancreatitis is commonly caused by gallstones and alcohol abuse. True or false? Answer: true. Rationale: gallstones and chronic alcohol consumption are the two most common causes of acute pancreatitis. 78. Thalassemia is a group of inherited disorders affecting hemoglobin synthesis. True or false? Answer: true. Rationale: thalassemia includes genetic conditions leading to defective production of alpha or beta globin chains in hemoglobin. 79. Parkinson's disease is primarily caused by the loss of dopamine-producing neurons in the cerebellum. True or false? Answer: false. Rationale: Parkinson's disease is caused by the loss of dopamine-producing neurons in the substantia nigra, not the cerebellum. 80. Hepatitis A is a blood-borne virus. True or false? Answer: false. Rationale: hepatitis A is transmitted via the fecal-oral route, not through blood-borne transmission. 81. Myocardial infarction occurs due to decreased blood flow in the pulmonary arteries. True or false? Answer: false. Rationale: myocardial infarction is caused by decreased blood flow in the coronary arteries, not the pulmonary arteries. 82. Cushing's syndrome is caused by excessive cortisol production. True or false? Answer: true. Rationale: Cushing's syndrome results from prolonged exposure to high levels of cortisol, either from endogenous overproduction or exogenous administration. 83. Sickle cell anemia is caused by a mutation in the hemoglobin beta gene. True or false? Answer: true. Rationale: sickle cell anemia is due to a mutation in the HBB gene, leading to abnormal hemoglobin, HbS, and sickling of red blood cells. 84. Hyperthyroidism can cause symptoms like heat intolerance, weight loss, and tachycardia. True or false? Answer: true. Rationale: hyperthyroidism increases metabolic activity, leading to symptoms such as heat intolerance, weight loss, and rapid heart rate. 85. Amyotrophic lateral sclerosis, ALS, affects motor neurons in both the central and peripheral nervous systems. True or false? Answer: true. Rationale: ALS is a neurodegenerative disorder affecting motor neurons in the brain, spinal cord, and peripheral nervous system, leading to muscle weakness and paralysis. 86. Huntington's disease is autosomal recessive. True or false? Answer: false. Rationale: Huntington's disease is an autosomal dominant disorder meaning only one copy of the defective gene is necessary for the disease to manifest. 87. Peptic ulcers are most commonly caused by stress and spicy foods. True or false? Answer: false. Rationale: the primary causes of peptic ulcers are Helicobacter pylori infection and the use of NSAIDs, not stress or spicy foods. 88. Hypertrophic cardiomyopathy is an inherited disorder affecting the myocardium. True or false? Answer: true. Rationale: hypertrophic cardiomyopathy is a genetic condition characterized by abnormal thickening of the heart muscle, particularly the interventricular septum. 89. Phenylketonuria, PKU, is screened for in newborns via blood testing. True or false? Answer: true. Rationale: newborn screening programs commonly test for PKU to enable early dietary intervention and prevent intellectual disability. 90. Lyme disease is caused by the bite of a tick infected with Treponema pallidum. True or false? Answer: false. Rationale: Lyme disease is caused by Borrelia burgdorferi, not Treponema pallidum, which causes syphilis. 91. Trisomy 21 is associated with Turner syndrome. True or false? Answer: false. Rationale: trisomy 21 is associated with Down syndrome, while Turner syndrome is caused by a missing or incomplete X chromosome. 92. Kawasaki disease is a self-limited vasculitis that primarily affects young children. True or false? Answer: true. Rationale: Kawasaki disease is an inflammatory condition affecting blood vessels, primarily in children under 5, and can lead to coronary artery complications. 93. The brainstem consists of the midbrain, pons, and medulla oblongata. True or false? Answer: true. Rationale: the brainstem comprises the midbrain, pons, and medulla oblongata, which are responsible for essential functions like breathing and heart rate regulation. 94. Duchenne muscular dystrophy is an X-linked dominant disorder. True or false? Answer: false. Rationale: Duchenne muscular dystrophy is an X-linked recessive disorder caused by mutations in the DMD gene encoding dystrophin. 95. The liver synthesizes bile, which is stored in the gallbladder. True or false? Answer: true. Rationale: bile is produced by the liver and stored in the gallbladder for release into the duodenum during digestion. 96. Osteoarthritis is a systemic autoimmune disease. True or false? Answer: false. Rationale: osteoarthritis is a degenerative joint disease caused by wear and tear, not an autoimmune process. 97. The hypothalamus regulates body temperature, hunger, and thirst. True or false? Answer: true. Rationale: the hypothalamus plays a central role in maintaining homeostasis by regulating temperature, hunger, thirst, and other vital functions. 98. Albinism is a genetic condition caused by a lack of melanin production. True or false? Answer: true. Rationale: albinism results from mutations affecting melanin production, leading to reduced pigmentation in the skin, hair, and eyes. 99. Beta blockers are used to increase heart rate in patients with bradycardia. True or false? Answer: false. Rationale: beta blockers decrease heart rate and are used in conditions like hypertension and tachycardia, not bradycardia. 100. Preeclampsia is characterized by high blood pressure and proteinuria during pregnancy. True or false? Answer: true. Rationale: preeclampsia is a pregnancy complication marked by hypertension, proteinuria, and other systemic disturbances, potentially progressing to eclampsia if untreated. 101. The main cause of chronic obstructive pulmonary disease, COPD, is long-term exposure to tobacco smoke. True or false? Answer: true. Rationale: COPD is primarily caused by long-term smoking, which damages the airways and lung tissue, although other environmental factors can also contribute. 102. Macular degeneration primarily affects peripheral vision. True or false? Answer: false. Rationale: macular degeneration primarily affects central vision, as it involves damage to the macula, the central part of the retina. 103. Hemodialysis is a treatment for end-stage renal disease. True or false? Answer: true. Rationale: hemodialysis is a medical treatment that removes waste products and excess fluid from the blood in patients with kidney failure. 104. Systemic lupus erythematosus, SLE, is more common in men than women. True or false? Answer: false. Rationale: SLE predominantly affects women, with a female-to-male ratio of about 9:1, especially during childbearing years. 105. Angina pectoris is caused by decreased blood flow in the coronary arteries. True or false? Answer: true. Rationale: angina is chest pain or discomfort caused by reduced blood flow to the heart muscle due to partial blockage or spasm of the coronary arteries. 106. Crohn's disease affects only the colon. True or false? Answer: false. Rationale: Crohn's disease can affect any part of the gastrointestinal tract, from the mouth to the anus, not just the colon. 107. Alzheimer's disease is a form of vascular dementia. True or false? Answer: false. Rationale: Alzheimer's disease is a neurodegenerative disorder caused by the accumulation of amyloid plaques and tau tangles, while vascular dementia results from reduced blood flow to the brain. 108. Polydipsia, polyuria, and polyphagia are classic symptoms of diabetes mellitus. True or false? Answer: true. Rationale: these are the three hallmark symptoms of diabetes mellitus, indicating high blood glucose levels affecting fluid and energy balance. 109. In adults, the most common primary brain tumor is glioblastoma. True or false? Answer: true. Rationale: glioblastoma is the most aggressive and common primary brain tumor in adults, characterized by rapid growth and poor prognosis. 110. Scurvy is caused by a deficiency of vitamin B12. True or false? Answer: false. Rationale: scurvy is caused by a deficiency of vitamin C, not B12, and leads to symptoms like bleeding gums and poor wound healing. 111. The appendix is located in the left lower quadrant of the abdomen. True or false? Answer: false. Rationale: the appendix is typically located in the right lower quadrant of the abdomen. 112. Paget's disease of bone primarily affects the joints. True or false? Answer: false. Rationale: Paget's disease of bone affects the bone remodeling process, not the joints, leading to abnormal bone structure and fragility. 113. Hepatic encephalopathy is a neurological condition caused by liver dysfunction. True or false? Answer: true. Rationale: hepatic encephalopathy is caused by liver dysfunction leading to the accumulation of toxins, such as ammonia, that affect brain function. 114. Hypovolemic shock results from excessive blood loss or fluid loss. True or false? Answer: true. Rationale: hypovolemic shock occurs when there is insufficient blood volume to maintain adequate circulation and tissue perfusion, often due to bleeding or fluid loss. 115. Klinefelter syndrome is characterized by an XXY chromosomal pattern. True or false? Answer: true. Rationale: Klinefelter syndrome results from an additional X chromosome, XXY, leading to symptoms like reduced testosterone and infertility in males. 116. Bacterial vaginosis is caused by an overgrowth of lactobacillus bacteria. True or false? Answer: false. Rationale: bacterial vaginosis is caused by an overgrowth of anaerobic bacteria, not lactobacillus, which is normally present in the vagina. 117. A positive Tinel sign is indicative of carpal tunnel syndrome. True or false? Answer: true. Rationale: Tinel sign is a test for carpal tunnel syndrome, where tapping over the median nerve causes tingling or pain in the fingers. 118. The primary function of the large intestine is nutrient absorption. True or false? Answer: false. Rationale: the primary function of the large intestine is water and electrolyte absorption, while nutrient absorption mainly occurs in the small intestine. 119. Hemophilia is a condition that affects the blood's ability to clot. True or false? Answer: true. Rationale: hemophilia is a genetic disorder where blood does not clot properly due to a deficiency in clotting factors. 120. diabetic ketoacidosis is more common in type 2 diabetes.
True or false?
Answer: false. Rationale: diabetic ketoacidosis is more common in type 1 diabetes, as insulin deficiency leads to fat breakdown and ketone production. 121. The most common site for peptic ulcers is the duodenum. True or false? Answer: true. Rationale: duodenal ulcers are the most common type of peptic ulcers, often caused by H. pylori infection or NSAID use. 122. Chickenpox can only be contracted once in a lifetime. True or false? Answer: false. Rationale: chickenpox is caused by the varicella zoster virus, and after initial infection, the virus can remain dormant in the body, reactivating later as shingles. 123. Asthma is characterized by reversible airway obstruction. True or false? Answer: true. Rationale: asthma involves reversible airflow limitation, typically triggered by inflammation and constriction of the airways. 124. Hypothermia occurs when the body's core temperature drops below 95 degrees Fahrenheit 35 degrees Celsius. True or false? Answer: true. Rationale: hypothermia is defined as a body temperature below 95 degrees Fahrenheit 35 degrees Celsius, leading to impaired bodily functions and potential organ failure. 125. The liver is responsible for producing insulin.
True or false?
Answer: false. Rationale: insulin is produced by the pancreas, not the liver. The liver plays a role in glucose metabolism, but does not produce insulin. 126. The optic nerve is responsible for transmitting visual information from the eyes to the brain. True or false? Answer: true. Rationale: the optic nerve transmits visual information from the retina to the brain for processing and interpretation. 127. The spleen is responsible for producing red blood cells in adults. True or false? Answer: false. Rationale: the spleen is involved in filtering blood and removing old red blood cells, but does not produce red blood cells in adults. This function occurs in the bone marrow. 128. A condition known as pheochromocytoma involves the overproduction of cortisol. True or false? Answer: false. Rationale: pheochromocytoma involves the overproduction of catecholamines, e.g., adrenaline, not cortisol. It affects the adrenal glands. 129. The vagus nerve is involved in parasympathetic control of heart rate. True or false? Answer: true. Rationale: the vagus nerve is part of the parasympathetic nervous system and helps regulate heart rate, lowering it during rest. 130. A positive Babinski sign indicates normal neurological function in adults. True or false? Answer: false. Rationale: a positive Babinski sign in adults, characterized by the upward movement of the big toe, is abnormal and indicates neurological damage. 131. A person with cystic fibrosis typically has difficulty breathing due to thick mucus production in the lungs. True or false? Answer: true. Rationale: cystic fibrosis causes thick mucus buildup in the lungs and other organs, leading to respiratory issues and infections. 132. Appendicitis is usually caused by an infection in the appendix. True or false? Answer: true. Rationale: appendicitis typically results from an infection or blockage in the appendix, leading to inflammation and potential rupture. 133. Hemorrhoids are swollen veins in the rectum or anus. True or false? Answer: true. Rationale: hemorrhoids are swollen blood vessels in the rectum or anus, causing discomfort, itching, or bleeding. 134. The thyroid gland is located behind the stomach. True or false? Answer: false. Rationale: the thyroid gland is located in the neck, in front of the trachea, not behind the stomach. 135. A person with rheumatoid arthritis will experience progressive joint degeneration. True or false? Answer: true. Rationale: rheumatoid arthritis is an autoimmune condition that causes progressive joint damage, pain, and stiffness. 136. The pituitary gland is considered the master gland because it regulates other endocrine glands. True or false? Answer: true. Rationale: the pituitary gland is known as the master gland because it controls and regulates other endocrine glands such as the thyroid and adrenal glands. 137. The lungs are responsible for producing oxygen.
True or false?
Answer: false. Rationale: the lungs facilitate the exchange of gases, including oxygen, but do not produce oxygen. Oxygen is absorbed from the air into the bloodstream. 138. The pancreas produces digestive enzymes and insulin.
True or false?
Answer: true. Rationale: the pancreas produces digestive enzymes to aid in digestion and insulin to regulate blood glucose levels. 139. Vitamin D deficiency can lead to rickets in children.
True or false?
Answer: true. Rationale: vitamin D deficiency can cause rickets in children, leading to weakened bones and skeletal deformities. 140. A person with bipolar disorder experiences periods of excessive energy and depression.
True or false?
Answer: true. Rationale: bipolar disorder is characterized by extreme mood swings, including manic episodes of high energy and depressive episodes. 141. The immune system is responsible for producing hormones that regulate growth.
True or false?
Answer: false. Rationale: the endocrine system is responsible for producing hormones that regulate growth, while the immune system protects the body from infections. 142. The kidneys are involved in regulating blood pressure.
True or false?
Answer: true. Rationale: the kidneys help regulate blood pressure by controlling the volume of blood and the levels of sodium in the body. 143. Rickets is a condition that affects adults due to vitamin D deficiency.
True or false?
Answer:
false.
Rationale: rickets primarily affects children, while osteomalacia is the adult version of the condition caused by vitamin D deficiency. 144. The primary function of the small intestine is nutrient absorption.
True or false?
Answer: true. Rationale: the small intestine is responsible for the majority of nutrient absorption from digested food. 145. Diphtheria is caused by a viral infection.
True or false?
Answer: false. Rationale: diphtheria is caused by a bacterial infection, specifically by Corynebacterium diphtheriae. 146. Celiac disease involves a sensitivity to gluten.
True or false?
Answer: true. Rationale: celiac disease is an autoimmune disorder triggered by gluten, leading to inflammation and damage in the small intestine. 147. The term myocardial infarction refers to a heart attack.
True or false?
Answer: true. Rationale: myocardial infarction is the medical term for a heart attack, which occurs when blood flow to the heart is blocked. 148. Polio is a bacterial infection that affects the nervous system.
True or false?
Answer: false. Rationale: polio is caused by a viral infection that affects the nervous system, leading to paralysis in severe cases. 149. The primary function of red blood cells is to transport oxygen.
True or false?
Answer: true. Rationale: red blood cells contain hemoglobin, which binds to oxygen and transports it throughout the body. 150. Acromegaly is caused by an overproduction of growth hormone.
True or false?
Answer: true. Rationale: acromegaly is caused by excess growth hormone production, typically due to a pituitary tumor, leading to abnormal growth of bones and tissues. 151. The main function of the lymphatic system is the production of red blood cells.
True or false?
Answer: false. Rationale: the lymphatic system is responsible for immunity and fluid balance, not red blood cell production, which occurs in the bone marrow. 152. Endometriosis is characterized by the growth of uterine tissue outside the uterus.
True or false?
Answer: true. Rationale: endometriosis occurs when tissue similar to the uterine lining grows outside the uterus, causing pain and possible infertility. 153. Chronic obstructive pulmonary disease, COPD, leads to reversible airway obstruction.
True or false?
Answer: false. Rationale: COPD involves irreversible airway obstruction due to chronic inflammation and damage to the airways. 154. Type 1 diabetes is caused by the body's inability to produce insulin.
True or false?
Answer: true. Rationale: type 1 diabetes is an autoimmune disease where the body's immune system attacks and destroys insulin-producing cells in the pancreas. 155. Sarcoidosis is characterized by the formation of granulomas in affected organs. True or false? Answer: true. Rationale: sarcoidosis is an inflammatory disease characterized by the formation of granulomas, often in the lungs, skin, and lymph nodes. 156. Asthma can be triggered by allergens, exercise, and respiratory infections. True or false? Answer: true. Rationale: asthma attacks can be triggered by various factors, including allergens, physical exertion, and respiratory infections. 157. Hyperthyroidism causes weight gain and fatigue. True or false? Answer: false. Rationale: hyperthyroidism causes weight loss, increased metabolism, and energy, not weight gain and fatigue. 158. Aneurysms can occur in any artery in the body, but the most common site is the aorta. True or false? Answer: true. Rationale: the aorta is the most common site for aneurysms, particularly in the abdominal and thoracic regions. 159. The primary symptom of multiple sclerosis is joint pain.
True or false?
Answer: false. Rationale: multiple sclerosis primarily affects the central nervous system, leading to symptoms like muscle weakness, coordination problems, and sensory disturbances, not joint pain. 160. The common cold is caused by the influenza virus. True or false? Answer: false. Rationale: the common cold is caused by rhinoviruses, not the influenza virus. Influenza leads to more severe illness, including fever and body aches. 161. The blood-brain barrier prevents certain substances from entering the brain. True or false? Answer: true. Rationale: the blood-brain barrier selectively prevents harmful substances, such as toxins and pathogens, from reaching the brain, while allowing essential molecules to pass. 162. A myocardial infarction results from the rupture of a coronary artery aneurysm. True or false? Answer: false. Rationale: a myocardial infarction occurs due to blockage of a coronary artery, typically from a blood clot, rather than the rupture of an aneurysm. 163. A person with Parkinson's disease typically experiences tremors, bradykinesia, and postural instability. True or false? Answer: true. Rationale: Parkinson's disease is characterized by tremors, bradykinesia, slowness of movement, and postural instability due to dopamine deficiency in the brain. 164. Hyperkalemia refers to low potassium levels in the blood. True or false? Answer: false. Rationale: hyperkalemia refers to elevated potassium levels in the blood, which can cause cardiac arrhythmias and muscle weakness. 165. Rheumatic fever is a complication that can occur after a streptococcal throat infection. True or false? Answer: true. Rationale: rheumatic fever can develop as a complication of a streptococcal throat infection, leading to inflammation of the heart, joints, and other tissues. 166. Crohn's disease primarily affects the small intestine. True or false? Answer: true. Rationale: Crohn's disease primarily affects the small intestine, causing inflammation, abdominal pain, and diarrhea. It can also affect other parts of the gastrointestinal tract. 167. Uremia occurs when the kidneys are unable to filter waste products from the blood. True or false? Answer: true. Rationale: uremia is the accumulation of waste products in the blood due to kidney failure or significant kidney dysfunction. 168. The main function of the kidneys is to regulate blood sugar levels. True or false? Answer: false. Rationale: the kidneys regulate fluid and electrolyte balance, blood pressure, and waste elimination, but they do not directly regulate blood sugar. 169. Preeclampsia is a pregnancy-related condition characterized by high blood pressure and protein in the urine. True or false? Answer: true. Rationale: preeclampsia is characterized by high blood pressure and the presence of protein in the urine during pregnancy, potentially leading to organ damage and complications. 170. The sympathetic nervous system is responsible for the rest and digest response. True or false? Answer: false. Rationale: the parasympathetic nervous system is responsible for the rest and digest response, while the sympathetic nervous system prepares the body for fight or flight. 171. Sickle cell anemia is a genetic disorder characterized by abnormally shaped red blood cells. True or false? Answer: true. Rationale: sickle cell anemia is a genetic disorder that causes red blood cells to become sickle-shaped, leading to blockages and a lack of oxygen in tissues. 172. Meningitis is an inflammation of the brain tissue. True or false? Answer: false. Rationale: meningitis is the inflammation of the meninges, protective membranes, surrounding the brain and spinal cord, not the brain tissue itself. 173. A person with tuberculosis will typically experience a persistent dry cough, weight loss, and night sweats. True or false? Answer: true. Rationale: tuberculosis symptoms include a persistent cough, weight loss, night sweats, and fatigue, often caused by the bacterium Mycobacterium tuberculosis. 174. Hepatitis B is primarily transmitted through airborne droplets. True or false? Answer: false. Rationale: hepatitis B is primarily transmitted through blood and bodily fluids, not airborne droplets. 175. Gout is caused by the accumulation of uric acid crystals in the joints. True or false? Answer: true. Rationale: gout is caused by the accumulation of uric acid crystals in joints, leading to painful inflammation, especially in the big toe. 176. The cerebellum is responsible for regulating breathing and heart rate. True or false? Answer: false. Rationale: the cerebellum primarily controls coordination, balance, and fine motor movements, while the medulla oblongata regulates breathing and heart rate. 177. Hemolytic anemia is characterized by the destruction of red blood cells. True or false? Answer: true. Rationale: hemolytic anemia occurs when red blood cells are destroyed prematurely, leading to a shortage of healthy red blood cells. 178. Anaphylaxis is a severe allergic reaction that can lead to shock. True or false? Answer: true. Rationale: anaphylaxis is a severe allergic reaction that can cause swelling, difficulty breathing, and shock, requiring immediate medical intervention. 179. The pancreas secretes insulin to raise blood sugar levels. True or false? Answer: false. Rationale: insulin lowers blood sugar levels by promoting glucose uptake into cells. Glucagon is the hormone that raises blood sugar levels. 180. Chronic kidney disease can result in a decrease in the glomerular filtration rate, GFR. True or false? Answer: true. Rationale: chronic kidney disease results in progressive damage to the kidneys, leading to a decreased glomerular filtration rate, GFR. 181. Graves' disease is an autoimmune disorder that causes hyperthyroidism. True or false? Answer: true. Rationale: Graves' disease is an autoimmune disorder that stimulates the thyroid gland to produce excessive thyroid hormone, causing hyperthyroidism. 182. Hyperventilation causes an increase in carbon dioxide levels in the blood. True or false? Answer: false. Rationale: hyperventilation leads to a decrease in carbon dioxide levels, respiratory alkalosis, because the body expels too much CO2 through rapid breathing. 183. Vitamin K is essential for blood clotting. True or false? Answer: true. Rationale: vitamin K is necessary for the synthesis of clotting factors, playing a crucial role in blood coagulation. 184. The term hepatomegaly refers to an enlarged spleen. True or false? Answer: false. Rationale: hepatomegaly refers to an enlarged liver, not an enlarged spleen, which is called splenomegaly. 185. The blood-brain barrier is impermeable to all substances. True or false? Answer: false. Rationale: the blood-brain barrier is selectively permeable, allowing certain substances like oxygen and glucose to pass through, while blocking harmful substances. 186. The adrenal glands are located on top of the kidneys. True or false? Answer: true. Rationale: the adrenal glands are small, triangular-shaped glands located on top of each kidney. 187. A person with anemia has an excess of red blood cells in the blood. True or false? Answer: false. Rationale: anemia is characterized by a deficiency of red blood cells or hemoglobin, leading to reduced oxygen transport in the body. 188. The primary cause of osteoarthritis is aging.
True or false?
Answer: true. Rationale: osteoarthritis is primarily caused by the wear and tear of joints over time, making aging a major risk factor. 189. A person with hyperlipidemia has high levels of cholesterol in the blood. True or false? Answer: true. Rationale: hyperlipidemia refers to elevated levels of lipids, including cholesterol, in the blood, which increases the risk of cardiovascular diseases. 190. Insulin resistance is a key feature of type 2 diabetes.
True or false?
Answer: true. Rationale: type 2 diabetes is characterized by insulin resistance, where the body's cells become less responsive to insulin, leading to elevated blood glucose levels. 191. A stroke occurs when there is a blockage or rupture of blood vessels supplying the brain. True or false? Answer: true. Rationale: a stroke occurs when blood flow to part of the brain is interrupted, either by a blockage, ischemic stroke, or a rupture, hemorrhagic stroke. 192. The large intestine absorbs most nutrients from food. True or false? Answer: false. Rationale: the small intestine absorbs most of the nutrients from food, while the large intestine primarily absorbs water and electrolytes. 193. The pituitary gland is often referred to as the master glands because it controls other endocrine glands. True or false? Answer: true. Rationale: the pituitary gland is known as the master glands because it regulates the activity of other endocrine glands, such as the thyroid and adrenal glands. 194. Antidiuretic hormone, ADH, regulates water balance by promoting urine production. True or false? Answer: false. Rationale: ADH regulates water balance by promoting water reabsorption in the kidneys, reducing urine production to conserve water in the body. 195. Cystic fibrosis is a genetic disorder that affects the respiratory and digestive systems. True or false? Answer: true. Rationale: cystic fibrosis is a genetic disorder that leads to thick mucus buildup in the lungs and digestive tract, causing breathing and digestive problems. 196. Sepsis is a severe infection that can lead to systemic inflammation and organ failure. True or false? Answer: true. Rationale: sepsis is a life-threatening condition caused by an infection leading to widespread inflammation, potentially resulting in organ failure. 197. Tuberculosis can be cured with antibiotics. True or false? Answer: true. Rationale: tuberculosis can be treated with a long course of antibiotics, although drug-resistant strains can complicate treatment. 198. The right ventricle of the heart pumps blood to the lungs. True or false? Answer: true. Rationale: the right ventricle pumps deoxygenated blood to the lungs for oxygenation through the pulmonary artery. 199. The term dyspnea refers to shortness of breath. True or false? Answer: true. Rationale: dyspnea is the medical term for shortness of breath or difficulty breathing. 200. Vitamin D is essential for bone health because it helps with calcium absorption. True or false? Answer: true. Rationale: vitamin D aids in the absorption of calcium from the intestines, which is crucial for maintaining strong and healthy bones. 201. The thyroid gland is located in the neck and regulates metabolism. True or false? Answer: true. Rationale: the thyroid gland, located in the neck, produces hormones that regulate metabolism, growth, and development. 202. The pancreas produces insulin and glucagon to regulate blood sugar levels. True or false? Answer: true. Rationale: the pancreas produces insulin and glucagon, hormones that help regulate blood sugar levels in the body. 203. The blood-brain barrier allows all substances to pass freely into the brain. True or false? Answer: false. Rationale: the blood-brain barrier restricts the passage of certain substances into the brain to protect it from harmful chemicals. 204. A person with hypothyroidism has an overactive thyroid gland. True or false? Answer: false. Rationale: hypothyroidism is characterized by an underactive thyroid gland, leading to slow metabolism and other symptoms. 205. The left ventricle of the heart pumps blood to the lungs. True or false? Answer: false. Rationale: the left ventricle pumps oxygenated blood to the body through the aorta, while the right ventricle pumps blood to the lungs. 206. A person with hypertension has high blood pressure. True or false? Answer: true. Rationale: hypertension refers to consistently high blood pressure, which increases the risk of cardiovascular diseases. 207. The kidneys filter waste products from the blood and produce urine. True or false? Answer: true. Rationale: the kidneys filter waste products and excess substances from the blood, forming urine for excretion. 208. Osteoporosis is a condition in which bones become too thick and dense.
True or false?
Answer: false. Rationale: osteoporosis is a condition where bones become thin, weak, and brittle, increasing the risk of fractures. 209. The large intestine is primarily responsible for nutrient absorption. True or false? Answer: false. Rationale: the small intestine absorbs most nutrients, while the large intestine mainly absorbs water and electrolytes. 210. The liver produces bile, which helps digest fats. True or false? Answer: true. Rationale: the liver produces bile, which is stored in the gallbladder and released into the small intestine to aid in fat digestion. 211. The autonomic nervous system controls voluntary movements. True or false? Answer: false. Rationale: the autonomic nervous system controls involuntary functions, such as heart rate and digestion, while voluntary movements are controlled by the somatic nervous system. 212. The red blood cells are responsible for carrying oxygen to the body's tissues. True or false? Answer: true. Rationale: red blood cells contain hemoglobin, which binds oxygen and transports it to tissues throughout the body. 213. A stroke can be caused by a blood clot or a ruptured blood vessel in the brain. True or false? Answer: true. Rationale: a stroke occurs when a blood clot, ischemic, or a ruptured blood vessel, hemorrhagic, disrupts blood flow to the brain. 214. The cerebellum is responsible for regulating heart rate and breathing. True or false? Answer: false. Rationale: the cerebellum controls motor coordination and balance, while heart rate and breathing are regulated by the brainstem. 215. The skin is the body's largest organ. True or false? Answer: true. Rationale: the skin is the body's largest organ, serving as a protective barrier and regulating temperature. 216. The diaphragm is a muscle that helps with breathing. True or false? Answer: true. Rationale: the diaphragm is a large muscle located beneath the lungs that contracts and relaxes to facilitate breathing. 217. A person with jaundice has yellowing of the skin and eyes due to liver dysfunction. True or false? Answer: true. Rationale: jaundice occurs when the liver is unable to process bilirubin properly, causing a buildup that leads to yellowing of the skin and eyes. 218. The spinal cord is responsible for carrying oxygen to the brain. True or false? Answer: false. Rationale: the spinal cord transmits signals between the brain and the rest of the body, but oxygen is carried to the brain by the blood vessels. 219. White blood cells help protect the body from infections.
True or false?
Answer: true. Rationale: white blood cells are part of the immune system and help defend the body against infections and foreign invaders. 220. The stomach produces digestive enzymes and acid to break down food. True or false? Answer: true. Rationale: the stomach secretes digestive enzymes and hydrochloric acid to break down food and kill harmful bacteria. 221. The heart's primary function is to pump blood to the lungs and other organs. True or false? Answer: true. Rationale: the heart pumps blood to the lungs for oxygenation and to the rest of the body to deliver oxygen and nutrients. 222. The lymphatic system is part of the cardiovascular system. True or false? Answer: false. Rationale: the lymphatic system is a separate system that helps with immune function and fluid balance, though it works closely with the cardiovascular system. 223. The gallbladder stores bile produced by the pancreas. True or false? Answer: false. Rationale: the gallbladder stores bile produced by the liver, not the pancreas, and releases it into the small intestine to aid digestion. 224. The medulla oblongata controls basic life functions such as breathing and heart rate. True or false? Answer: true. Rationale: the medulla oblongata is part of the brainstem and controls vital functions like breathing, heart rate, and blood pressure. 225. The femur is the longest bone in the human body. True or false? Answer: true. Rationale: the femur or thigh bone is the longest and strongest bone in the human body. 226. The adrenal glands produce adrenaline during times of stress. True or false? Answer: true. Rationale: the adrenal glands produce adrenaline epinephrine, a hormone that helps the body respond to stress by increasing heart rate and blood pressure. 227. A person with hyperthyroidism has an underactive thyroid gland. True or false? Answer: false. Rationale: hyperthyroidism is characterized by an overactive thyroid gland, leading to a rapid metabolism and other symptoms. 228. The pituitary gland is located at the base of the brain and regulates growth.
True or false?
Answer: true. Rationale: the pituitary gland regulates growth, metabolism, and other hormonal functions by releasing hormones that affect various glands. 229. The humerus is the bone in the upper arm. True or false? Answer: true. Rationale: the humerus is the bone in the upper arm, connecting the shoulder to the elbow. 230. The esophagus connects the throat to the stomach. True or false? Answer: true. Rationale: the esophagus is a muscular tube that transports food from the mouth to the stomach. 231. The spleen is responsible for filtering blood and storing red blood cells. True or false? Answer: true. Rationale: the spleen filters blood, removing old or damaged red blood cells, and stores healthy red blood cells for future use. 232. A person with asthma has difficulty breathing due to constricted airways. True or false? Answer: true. Rationale: asthma is a respiratory condition where the airways become inflamed and narrowed, making it difficult to breathe. 233. The corpus callosum connects the two hemispheres of the brain. True or false? Answer: true. Rationale: the corpus callosum is a bundle of nerve fibers that connects the left and right hemispheres of the brain, enabling communication between them. 234. The pancreas produces enzymes that help digest food in the small intestine.
True or false?
Answer: true. Rationale: the pancreas produces digestive enzymes, which are released into the small intestine to break down food. 235. The temporal lobe is responsible for processing vision. True or false? Answer: false. Rationale: the occipital lobe is primarily responsible for processing vision, while the temporal lobe is involved in processing auditory information and memory. 236. The epidermis is the innermost layer of the skin.
True or false?
Answer: false. Rationale: the epidermis is the outermost layer of the skin, while the dermis is the layer beneath it. 237. The vagus nerve helps regulate heart rate and digestion. True or false? Answer: true. Rationale: the vagus nerve is part of the parasympathetic nervous system and helps regulate heart rate, digestion, and other involuntary functions. 238. Hemoglobin is the protein in red blood cells that carries oxygen.
True or false?
Answer: true. Rationale: hemoglobin is the protein in red blood cells that binds oxygen and carries it from the lungs to the tissues. 239. The occipital lobe of the brain is responsible for processing sound. True or false? Answer: false. Rationale: The temporal lobe processes sound, while the occipital lobe processes visual information. 240. The trachea is the windpipe that connects the throat to the lungs. True or false? Answer: true. Rationale: the trachea is the tube that carries air from the throat to the lungs for breathing. 241. The iliac arteries supply blood to the legs. True or false? Answer: true. Rationale: the iliac arteries supply blood to the lower limbs, pelvis, and abdominal organs. 242. The cerebrum is responsible for controlling voluntary muscle movements. True or false? Answer: true. Rationale: the cerebrum controls voluntary movements, along with functions like reasoning, problem-solving, and emotions. 243. The cochlea is part of the digestive system. True or false? Answer: false. Rationale: the cochlea is part of the auditory system, located in the inner ear, and is responsible for hearing, not digestion. 244. The large intestine is also known as the colon. True or false? Answer: true. Rationale: the large intestine is commonly referred to as the colon and is responsible for absorbing water and electrolytes. 245. The pituitary gland is also known as the master gland because it regulates other endocrine glands. True or false? Answer: true. Rationale: the pituitary gland controls other endocrine glands, such as the thyroid, adrenal, and reproductive glands. 246. The appendix is a vital organ for digestion. True or false? Answer: false. Rationale: the appendix is a small, vestigial organ with no essential function for digestion, although it may play a role in immune function. 247. The left side of the heart pumps oxygenated blood to the body. True or false? Answer: true. Rationale: the left side of the heart pumps oxygenated blood into the aorta and then to the rest of the body. 248. The tibia is the longest bone in the lower leg. True or false? Answer: true. Rationale: the tibia, also known as the shin bone, is the longest and stronger of the two bones in the lower leg. 249. The pharynx is the part of the respiratory system that filters air. True or false? Answer: false. Rationale: the pharynx is a passage for air and food, but air filtration is mainly done by the nasal passages and the trachea. 250. The pineal gland is responsible for regulating sleep-wake cycles. True or false? Answer: true. Rationale: the pineal gland produces melatonin, a hormone that regulates sleep-wake cycles.